staff management. Now, when you say staff management, that is where you're going to see 4 types of questions. 4 types of questions or 4 types of answers. Who are these 4 types of answer? Tell supervisor, confront them, talk to them later, ignore them. A patient a nurse is seen discussing with another nurse about a patient. What should you do? A. Tell your supervisor, confront them, talk to them later, ignore them. That is where you now see options like that. So, ability to understand what and what to do in this kind of situation will help us to be able to handle questions of such. Now, what is the rule that guides answering staff management question? Now, the question is, what we must have at the back of our mind is, how do you intervene with inappropriate behavior from staff? How do you intervene with inappropriate behavior from staff? So, which means this is an area that we need to look out for. Now, is this situation going to cause harm? Or is this situation going to make things worse? Those are questions we need to ask ourselves. So the first rule says that never ignore inappropriate behavior. Never ignore inappropriate behavior. So, anything ignore as an answer is out of the way. So when you see an option telling you what should you do, ignore the behavior. That word ignore, that is number 1 wrong answer. So if you need to strike out answers, the first thing you need to strike out is when you see an option that tell you ignore. Because in the hospital setting, safety comes first. So any option that tell you ignore, that is number 1 wrong answer. So the question is this: how do I choose between tell supervisor, confront them, or continue with take over the procedure, or talk to them later? How do I know which one to take? Either to tell supervisor, confront them now, or confront them later. How do I know which of them to use? Since we already agree that ignore them as an option is out of the way. So we now have 3 options. How do I choose among these 3 options? Now, choosing among these options, we need to ask ourselves 3 questions. Number 1, is the staff doing something illegal? Is the staff doing something illegal? If the staff is doing something illegal, the answer to such a question is tell supervisor. I repeat myself. Is the staff doing something illegal? If the question is asking you, in the question the staff is doing something illegal, the best option for such a question is to tell supervisor. 2, what if the staff is not doing something that is illegal? The staff is not doing what the staff is doing is not illegal. What should you do? Then ask yourself this question. Ask yourself this question. Is anyone, including the patient or other co-workers, are they in immediate physical or psychological harm? This thing the person is doing, will it cause physical, psychological or psychological harm to the patient or to other co-workers or to other staff, since it is not illegal? If it's going to cause harm to the patient, cause harm to other workers, what should you do? Confront them immediately. And I repeat myself, the first rule says, if the staff is doing something illegal, report straight to supervisor. 2, if this nurse or the co-worker is doing something that is not illegal, but that thing is going to cause harm to the patient or cause harm to other staff member, confront them immediately and take over the procedure, or confront them. But if you see option that say take over the procedure, take over the procedure, confront and take over the procedure. Third rule: if no harm is on the way, that's to say it's not going to cause any harm, it is not illegal, and it is not going to cause any harm to anybody, what do? The simple appropriate is to talk to them about the whole thing later. Talk to them about it later. So, which means that if there is no harm on the way, ask yourself if this behavior is simple, inappropriate. If so, talk to that particular staff at a later time about this. That's when you do so. It's not good though. Mind you, 3 things you must have at the back of your mind to be able to answer questions that ask us: tell supervisor, confront them, talk to them later, ignore them. And I said, anything ignore is out of the way. So the 3 options that we must tackle is the option of tell supervisor, confront them, next talk to them later. And the rule that guides this question or option is that number 1, if the staff is doing something that is illegal, tell supervisor straight. If the staff is doing something that is not illegal but will harm the patient and harm other staff member, confront them. If what he's doing is not illegal and will not cause or pose immediate threat or harm, what do? Talk to them later. Talk to them about it later. Let's take, for example, let's take some example about using this rule. For example, 1, you suspect the RON is diverting narcotic. You suspect the registered nurse diverting narcotic. What should you do? A, tell supervisor. B, confront them. 3, talk to them later. Ask yourself the question: a nurse is diverting narcotic. The question is it illegal? Is it going to cause harm? Will it not cause harm? Now the question is it legal for the nurse to divert narcotic? The answer is it is illegal. Because it is illegal, straight up, the answer is report to supervisor. Now let's take another example. The assistant nurse is giving perennial care. The assistant nurse is giving perennial care to the patient, not wearing hand glove. Not wearing hand glove. The assistant nurse is giving perennial care to a patient, not wearing hand glove. What should the nurse do? A, tell the supervisor, confront the patient, talk to the patient later. The question is this: a nurse and aide not wearing hand glove, is it illegal? It is not illegal. The question is, will it cause harm to the patient and other staff member? Of course, yes, because it can lead to transmission of infection. So what do? Confront them. So that is what we must look out for. Next, a registered nurse is going home with a bulging pocket. A registered nurse is going home with a bulging pocket. The question is this: of course, going home with a bulging pocket, it is something that poses a suspicion that probably she is stealing. So what do? You don't confront. It is illegal. Straight to your supervisor. So that is what we must have at the back of our mind. Now, just like I said, imagine when the other questioner comes that a registered nurse always give report, always say, let's say exacerbation, or let's assume he's using a wrong statement. Just imagine when you instead of fever is now using hyperthermia, or using a statement that He's using a statement that he's not spelling very well. Is what he's saying, what he meant is not what he is spelling. His intention is not what is being documented. So what do? You can talk to them later. I think this thing you are spelling it wrong. Oh. Why? That can bring embarrassment. So what do you do in that situation? You correct them later. Why? Because it is not illegal. It's not causing harm to anybody. So what have I said in summary? For us to be able to manage situation and not to fall for victim of staff management that tell us either tell supervisor, confront them, talk to them, or ignore them, the rule says that anything ignore should be avoided. So anything ignore, never go for such option. The option you should go for is either between tell supervisor, confront them, and talk to them later. So what is the rule? We say if what they are doing is illegal, tell supervisor immediately. If what they are doing is not illegal but can pose harm, confront them. If it's not illegal and it's not going to cause immediate harm, what do? Talk to them later. So that is where we stop on this voice note. Thank you.